Thank you everyone for joining us tonight for our first client night, our senior pet information evening. So my name is Charlotte. For those of you that have not met me before, I'm one of the vet nurses here at Rouse Hill Family Vets. I'm very excited about tonight. I have a very, very strong passion for senior pets and believe it is very important that we look after them and their well-being and their general health throughout their golden years to make them nice and comfortable and happy. I am a senior pet.
You've one job.
One job. I'll just leave it now. So I am a senior pet owner myself. This is Summer. She's a 12-year-old border collie. She takes it pretty easy now. She used to have very typical bouncy border collie behaviour. Some things I noticed as she started to grow older, as you can see there, she got slower on walks, getting up and down. She was licking her legs a lot, licking her limbs a lot, reluctant to jump up onto my bed, and just generally restless at night, which I'm sure some of you have probably seen in your pets before. So things that I do myself now for Summer to try and help her in her senior years. So she gets regular blood and urine testing every 6 to 12 months. Actually, this year alone, we've found 2 urinary tract infections and some other changes to do with her kidneys that we wouldn't necessarily have known about before, which is now the vets can keep an eye on that. She has supplementations, so for her arthritis, she gets Antinol Rapid. She also gets a senior care powder, which is good for her brain function, and anxiety powder. She's always been quite an anxious dog, and just lately over the last sort of year or so, that restlessness at night, pacing up and down, just more and more anxious, so that helps. And then she's on medical management as well in terms of anti-inflammatories and pain relief, and that seems to keep her nice and comfortable. So tonight, Dr. Nicole and Dr. Belinda will be discussing a lot more in depth the things we do when we do health checks on your senior pets, the tests we do, what we're looking for, what we're trying to prevent, and ways to just keep them nice and happy in their older years. Also tonight we do have a quiz. If you've all got your quiz sheets, there are some good prizes to be won, some free giveaways. So yeah, I hope everybody enjoys the evening.
So my name's Dr. Belinda, and I am really passionate about senior pets. My current fur kid Elmo on the right, no, that's my right, your left. On the left he's just turned 8 years old, so he's a recent senior citizen of the pet world. But in the decade prior to that, I did feel like I was a old age pensioners home for dogs, because I had Jack, Percy and Cassie all living with me, and Jack was 19 when he passed away, which was incredible. Little Percy was the funkiest, crustiest little old chihuahua you could imagine. He was just the best. He came to me as a rescue as well, and he had Cushing's disease and a whole bunch of different old man ailments. And then little Nana Cassie over here, I'll talk to you about her a little bit more when we go through and talk about a couple of case studies and things to look out for in our senior pets that we need to be worried about. Okay, so the first topic we're going to discuss is common diseases in senior pets. So we're not going to go to the next slide just yet, because I'm going to ask you a couple of questions and see what do you think are the most common diseases in senior pets?
Arthritis.
Yep, arthritis, definitely.
Cushing's disease.
Cushing's disease, yes. Percy. Arthritis, all 3. Hopefully not Elmo yet.
Can I ask what is Cushing's disease?
Yeah, Cushing's disease. So what it is the job of the adrenals is to produce steroid. And sometimes they will get, dogs, mainly dogs, some cats, will get a tiny little benign tumour on the brain that sends signals to the adrenal glands, and it says, hey, keep producing steroids. And so then you have too much steroid in your system. and so then that you get symptoms associated with too much steroids. So if you've ever seen an animal be prescribed steroids, you will get temporary side effects from being on those. You'll get increased thirst, increased appetite, and increased toileting as well. So it is definitely something that we do see in our senior pets. Anything else that you can think of?
Blindness, deafness.
Yeah.
Diabetes.
Yep. Diabetes. Yep. What do you think's most? What do you reckon's the most common one?
Heart disease.
Heart disease. Yeah, it's pretty common as well. Arthritis. Yeah, arthritis. So we'll flick over to the next slide. And so this kind of gives us an idea of the occurrence of common senior pet diseases. So 40% of all dogs and cats will get arthritis. As they get older, that percentage goes up because that's 40% of all dogs and cats. Cats in particular, 10% of cats over 10 years of age will develop hypothyroidism. So hypothyroidism, the job of the thyroid is to control their metabolism. So often if they've got hypothyroidism, they're going to be eating lots because they're really hungry, but they'll still be losing weight. So that you'll see that as a common symptom, and it gives them, they get a bit hangry as well, so they get a bit cranky too when they've got hypothyroidism.
Can we get that?
Yeah, we can get hypothyroidism.
Great.
Yeah. Yes. You may also get hangry. So kidney disease is very common as well, particularly in senior cats. So 30% of cats over 15 years of age will get kidney disease. It's not quite as common in cats, with only 10% of cats over 15 getting kidney disease. Diabetes, I actually thought it might be slightly higher, but it's actually quite a low occurrence. 1% of cats will get diabetes, and 0.36% of dogs. So it's roughly 1 in 300 dogs will get diabetes. This is quite an interesting one. Urinary incontinence can happen in female dogs, so at a rate of about 20%. We're more likely to see that as they get older. And then canine cognitive dysfunction is doggy dementia. So that's something that by the time they get into ages 11 and 12, you're going to be seeing more of that. My own dog Jack, he definitely had doggy dementia. Getting to 19, you can't have all your faculties perfectly intact by the time you're 19. So 28% of dogs between age 11 and 12 will have some cognitive decline. I guess one thing we all worry about, I think, is cancer in our pets. So roughly 1 in 4 dogs and 1 in 5 cats will develop cancer in their lifetime. Not all cancer is nasty, okay? So that does include the benign types of cancer as well as the nasty types. And then heart disease is pretty common too. So 10% of dogs will get heart disease, 15% of cats will get heart disease. The tricky thing with cats is it's not as easy to diagnose heart disease in cats. It's a lot harder to identify it in cats than it is in dogs. So, yeah, absolutely.
The dog, Jack, was 19.
Yeah.
What was that in human years?
Whoa, he was well over 100. He was like a serious grandpa. By the time he got to 19, so I do talk about Jack quite often in consult when I'm talking to senior pet owners, because I think everybody gets so worried about like anesthetics and things like that with their senior pets. Jack, in his last year of life, he had 3 dentals, because for me it was really important that I kept his quality of life good, I kept his mouth comfortable, and I kept he had early kidney disease, so as well I wanted to make sure I was reducing the risk of bacteria affecting his kidneys as well. So if he's got a really bad mouth, then he's going to be absorbing bacteria through his bloodstream, that's putting extra pressure on his already struggling kidneys. So yeah, so he taught me a lot, Jack. There was a lot of different things that he taught me, but yeah, I guess when you get to 19, you're going to collect quite a few conditions as you go. Exactly, like I'll take one of that and one of this. Okay, perfect. So I thought we'd go on to do a bit of a case study. So this is my Nana Cass, little Cassie Wassy. So she came to me when she was 6, and she lived the best part of her life with us. So she, at age 12, I noticed over about a month, she started losing a bit of weight. She was still eating as normal, but I noticed her weight just starting to drop. And she was never a chunky monkey, she was always fairly lean, but she just was getting more lean. And then over a few days, I noticed her visiting the water bowl more frequently. And she also urinated in the house, which she never does. Like, she had like the bladder of steel. She could be like, nope, it is raining, I am not peeing, you cannot make me, I can hold on for 24 hours. So there's a few things there that I'm worried about. But I guess, what should we do? Should we ignore it, clean up the weed, and hope she doesn't do it again? Should we increase her food and give her free access to more water and put a pee pad in the house? Or should we take her in for a checkup, as there's a couple of things that shouldn't be ignored? Yeah, yep, I think I gave that away as well. Let's go talk about some red flags. Okay, so there's 3 main red flags in Cassie's history. So, weight loss with no diet or no obvious explanation. So if your pet is losing weight, but you're not trying to make them lose weight, that's something that we need to check up on to find out why they're trying to lose weight. It is a non-specific sign, so it doesn't point to one thing, but it points to many things that we need to just rule out. So it could indicate that she's got something wrong with her gastrointestinal system, something wrong with her liver or her kidneys, or it could indicate that there's maybe cancer somewhere. It could be so non-specific. It could be many things. It could be muscle mass that she's losing because she's getting arthritic and she's not moving as much, right? So it's many things it could indicate, but it needs to be checked out. The second red flag is that she had increased thirst. So she's drinking more water. So that might be seen in a couple of different ways. So with dogs, it might be, oh, she's back at the water bowl again, or the water bowl's getting empty. With cats, you don't generally see them drink. So then you're suddenly like, hey, I don't ever see you drink, and now I'm seeing you drink. Like, that might be a sign with them that if you never normally see them drink, and then they're suddenly at the water bowl, or they're drinking out of the sink, or drinking out of the shower, you're like, that's not normal, okay? And increased thirst can indicate a number of things. It can indicate kidney disease, it can indicate diabetes, Cushing's disease, urinary tract infections, thyroid disease in cats, less common in dogs, and other things as well. And then the third red flag is the toileting accidents, or increased urination. So increased urination kind of goes hand in hand with, if you're drinking more, you're going to be peeing more. But then having accidents, that's not necessarily, like, that can be related to drinking more water, but sometimes if they're having accidents, it might not be because of all those conditions I've discussed up here. It could be because they are getting a degree of hormonal responsive incontinence as they get older, especially if they're a girl dog. It could be that they've got arthritic pain, or they're starting to get pinched nerve, and that's not allowing, like, their continence isn't as good because of the pinched nerve. So if we're having accidents and they never normally have accidents, or if they're laying down and leaving a puddle behind, they're all signs that they need to be checked out, because there's things we can do about all these things, right? It's not that it's like, oh, we check it out, yeah, that's bad, and then nothing happens. We can do things to help improve their quality of life. So what happened with Cassie? I went into freak out mum vet mode, which is normally what happens, because I've got a lot of information in my head and I go straight to the worst case scenario. So we did full bloods, we did full urinalysis. We found that Cassie had what's called a protein-losing nephropathy. So what that is, that's a really bad form of kidney disease. It's also really rare. It doesn't happen very often that they get protein-losing nephropathies. More likely than not, they'll get kidney failure, but because she's a vet's dog, she couldn't get the normal one. She had to get the difficult one. I went as far as biopsying, or doing an ultrasound-guided biopsy of her kidney, and we found out that she had amyloid deposits getting jammed in her kidney, and that was stopping her kidney from functioning normally. So I wasn't able to do much about that, but we were able to have an incredible 6 months with her. We were able to support her kidneys as best as we could for the time that she had with us, and she had really good quality of life, and we were able to get our head around what was happening and be able to say goodbye. And even though it wasn't a wonderful outcome for Cassie, it actually was good, because we knew what was happening, we could slow down progression, and we could just make sure she had a really good quality of life for that last part of her life. So hopefully though, if those things happen, more often than not, the increased thirst and a bit of weight loss is not going to be amyloid deposits in the kidney. That is extremely rare. Okay, so we'll go on and we'll do another case study, because I just want to talk about some other red flags that I want you to be aware of with your senior pets. So Ruby, she's an 8-year-old Cavalier King Charles, and her family's noticed she's getting more tired more easily on walks. and that she's coughing and retching a little bit after drinking or going for a walk and getting excited. That's sort of bringing on the cough and the retching. And then she seems to be breathing hard. She's laying down, she's not doing anything, but she just seems to be breathing quickly. So not necessarily panting, but just breathing fast when she's not doing anything. So what should we do? Should we just walk her less and hope it doesn't get worse? Or is she obviously unfit and we just need to, like, you know, get her cardio up, do some exercise and make it better? Or should we book in for a checkup and maybe count her resting respiratory rate? Yeah, we should probably get that checked. All right. So again, these are 3 more red flags to look out for. So getting more tired more easily. And for cats, this can be, you know, they used to play with you more or play with you for longer, but then they're just getting more puffed out more quickly, or they're just like, oh, no, can't even be bothered. So again, it's non-specific, but if you notice a sudden decline, or if you notice like there's quite it's a gradual decline, but it's quite obvious over time, it shouldn't be ignored. It can indicate heart disease, it can indicate lung disease, weakness from other conditions as well, like kidney failure, diabetes, Cushing's and more, and it can even indicate pain. Cats in particular, we'll talk about that soon. Cats in particular are really good at hiding their pain, so they're just like, I'm just not going to do anything, so you can't see that I can't do it. And then number 5 is coughing and retching daily. Like that's pretty, like there's increased frequency, that's happening too much, and it's okay if it's the odd one here or there, but if you're really seeing that it's happening all the time and it's happening much more frequently, then that should get checked out, just to make sure that there's nothing more sinister underlying or nothing that we don't need to be aware of, because that could indicate that maybe they're getting a chest infection. It could indicate that they've got underlying degenerative airway disease. So some dogs will get what's called dynamic airway disease, where their trachea might start collapsing and things like that. And coughing in cats is particularly worrying, so we always like to do a checkup with cats, because cats, again, they will do whatever they can to avoid showing us that anything is wrong. So they'll be like, I'm not coughing, it's fine, and then if they're actually coughing or open mouth breathing, again, that's another red flag. And then increased breathing rate. So that's when I want to make sure everyone understands this is resting respiratory rate. So they're not doing anything, they're just having a lay down, they're nice and relaxed, they might even be asleep, but then they're breathing quickly at that point, or breathing like fast. So if they're laying down, sleeping, relaxing, and they're breathing faster than 30 breaths a minute, it's a red flag and it needs to be checked, because it could indicate issues with them being able to move enough oxygen around their body or catch their breath. So it tends to indicate severe heart and lung disease. So it's things like if they were in congestive heart failure and fluid was building up on their lungs, one of the things that we do to monitor that is we monitor this resting respiratory rate at home. So we want it to be less than 30 breaths a minute. So I guess what ended up happening with Ruby, Ruby is a Cavalier King Charles. They're super prone to heart disease. It's really common for them to have leaky heart valves. And the gene that causes the leaky heart valve also happens to cause dynamic airway disease. They're very closely linked together. So the coughing was more dynamic airway disease, so the collapsing trachea, but the breathing quickly is more the heart failure side of things, from the heart being enlarged and fluid building up back onto the lungs as well. Whilst we can't cure the leaky heart valve and we can't cure the dynamic airway disease, there's lots of studies that show if we catch a leaky heart valve early and start them on medication, as soon as their heart starts to show signs of stretching, we can significantly increase their survival time, and they have very good quality of life. They don't know they have heart disease, and that is ultimately what we want, right? They may not be able to be a mega athlete and run marathons, but they're able to be really happy, pets in the house. Okay, yeah. So there's no homework. You don't have to memorize any of this. We have provided you with a senior pet checklist, and it kind of goes through the common behavioural changes, the physical health things, and overall wellbeing things to be looking out for with your pets. So it's always good to just kind of have a look over that, get familiar with it, and then whether you just kind of go through it once a month, just be like, does it look like any of these things are happening or changing that you need to be aware of? So that's the senior pet checklist that's in your bag, and I think, Any questions about senior pet diseases while we're finishing up that one? Yeah.
Just a question about what would be the normal resting respiratory rate for the cat?
Yeah, look, again, it's under that 30 breaths a minute is ideal. So and it can be as low as like 8. So you wouldn't be too worried if it's like down that low. It's more that if it's consistently above that 30 that we start to get worried.
I'll get stuck by church.
Yeah. And it's really hard to like, you're like, are they breathing? Like, you're looking for the chest rising and falling. Yeah, so.
That was what I was going to ask. How do you count
Yeah, exactly.
cats?
Yeah.
'Cause sometimes they're like so deep in sleep.
100%.
Snoring and I don't.
Exactly. You're like, how am I? You're like, okay, I need something behind you so I can see if your chest is going up and down. So it's like just trying to see if you can. You kind of, I find that it takes me a bit of time to just like staring at them, and then I'm like, right, now I can see it. Now I'll get my watch ready. So yeah, you're just looking for that very subtle movement, because you'll see they're not taking really deep breaths and making it obvious for you. Especially cats, they want to hide everything. They're like, no, I don't even breathe. Okay, so we're going to talk about common signs of pain in pets. I think one of the most common things that we hear in a consult is, my dog's limping, but he's not in pain. The other one is followed by, but they're not crying, so they're not in pain. And these are fallacies, because if their leg was comfortable, they would be walking on it normally. Especially if it's been like normal walking and then suddenly we're limping. Generally, the reason for that, more than 9 times out of 10, is because that leg is painful when they're putting it down, or it's unstable, or it hurts. And then I don't cry all the time when I'm in pain. I cry when I'm in really bad pain, but as a general rule, like I had a bad back for 12 months and I didn't cry every day. Like it hurt me every day, but I didn't cry every day. So just like us, they're not going to cry every day when they're in pain. I can't remember what's on the next slide, so we'll just see. Perfect. All right, so again, you've got this checklist in your bag as well. So I think because we're sort of talking about mobility, we'll talk about their gait. Like, what are we looking out for when we're trying to work out if a pet is in pain? Because we've got to be detectives, right? They're going to try to hide it, particularly cats, because that's a survival instinct. Again, they're going, no, I'm fine, nothing to see here. And so we're going to see that when they're moving around, they're going to be a bit more stiff when they're in pain. They're not going to be moving as freely as they would normally. Dogs in particular might lag behind on walks. Or cats, say, following you to the food bowl, normally they're like, oh my gosh, food, amazing, I'm coming with you. They might be like, I'm coming, and they're just like not quite keeping up like they used to. Both of them may be slow to get up. They might be like, oh, a bit stiff and sore, sort of like, I guess, me in the morning sometimes. If I've been to the gym, I'm like, oh man. And then the stairs are really helpful. I mean, they're not great when you're an old pet to have to go up and down the stairs, but they're a good indicator to see both in dogs and in cats how they're moving up and down them, because that will help to give us early indicators that they're having trouble with pain as well. So cats might bunny hop up the stairs, or small dogs might bunny hop up the stairs. Some cats do like to do that, but if they're having trouble with the bunny hopping, they're not going to be doing it like over a couple of stairs. They're going to be like bunny hop, stop, bunny hop, stop. Or they might be really hesitant with the stairs as well. And then going down the stairs as well, where they used to go like straight down the stairs, they might be like, oh, no, they'd be really, really slow going down. Cats and dogs both might give up playing a little bit sooner than they would normally. So they might be like, I'm happy to play, and then as they're getting older and more stiff, they're like, no, that's not for me. Cats, one of the things cats will do, you'll see with their jumping up. So if like they normally would jump straight up onto the bench, as they're getting signs of arthritis, they're going to hesitate before they jump up. They're going to look, they're going to line it up a bit before they jump up. The other thing they might do, they're super smart, I said. So, they're going to be like, there's a chair next to the bench. I'm going to jump on the chair and then I'm going to jump on the bench. And the same coming back down. So instead of just being like, ping, up, down, they're going to be like, I'm going to take the long way, because it hurts when they're landing. Yeah, I think that's those ones. And then we talk about some subtle signs of pain. So you get emotional signs of pain as well. I know when I had the bad back, I was a little bit more cranky. Tried hard not to be, but I was a little bit more cranky. And I was restless. It was hard to sit and get in a comfortable position, and you'll see that with our pets as well. They might be restless, they might get agitated, they might be cranky. And sometimes they're more fearful of you as well. They're like avoidant of you. And they can even become hypersensitive to touch. So you go to pat them and they flinch and you're like, oh, I'm sorry. They can get depressed and lethargic like we can. We're like, oh, it hurts when I move, so I don't want to move. The other thing that you will notice, and I've tried so hard to find a video for you, but I cannot find one, but it's, you know, like you'll see dogs or cats will do the circle before they like go to lay down. They're like, oh, I'm just gonna make a nice little circle and then I'm gonna lay down and I'll sit. And then they'll get comfortable and they'll go to sleep. If they've got arthritis, they're gonna take ages. They're gonna be like, and they're gonna keep going around in a circle. They're gonna sit down and they go, no, that didn't work. They're gonna get back up again. They're gonna try again. So you'll see them doing that over and over again. They'll have weird posture. So they might be really hunched in their back, might be holding a leg at a weird angle when they're sitting down. You'll just notice that they always sit with one leg out, or they'll never lay on one side. Lameness that we already talked about. And then licking or chewing, like Charlotte was saying with Summer, that's not his name, with Summer, she was licking at her legs and things, and Jack definitely did that. He had referred pain from his tricep. He had a trigger point in his tricep, and he would just lick the front of his leg. And until I treated the tricep trigger point in his leg, then he suddenly stopped licking the front of his leg, and I was like, oh my gosh, I'm so sorry, I didn't know that was so sore. And then you may see trembling, particularly as they get weaker and their muscles are getting not as strong, and they're pain, they might tremble, or you might find that there's certain muscles that are really tight with them as well. Okay, these are some videos that I stole from Zoetis. So the great thing about this is that you can see that she's looking to go up on the bench because there's a piece of ham up there. She doesn't want to get up there. Now this is after they've treated pain. So we'll talk a bit about, and you can see she's like, oh yeah, I can get up there now, right? So I think that a lot of the time, because pain is so subtle, it's not until we treat the pain that we actually see the difference it makes. So here she is, she's playing with a toy, and then she's treated for arthritis, and she's like, oh yeah, now I am playing with a toy. Like this is, you know, she's much more active. And again, this is that sort of abnormal posture. See how arched her back is, and she sort of looks like she's walking on hot coals. And then here she comes after she's had some treatment. And look, yes, Silencia is a treatment for cats for arthritis. It's not the only treatment. We'll be talking about other things. They just have really good videos. And you can see how she's so much quicker going up the stairs. So you're looking for these sort of subtle signs. The tricky thing is when you're with them every day, you don't always notice this, which is why I say sometimes you have to do a pain management trial to see how different they move. And then these are some dogs. Very obvious limping here. She's not a normal gait. She's got a very sore leg. This one's pretty cool. I'm pretty sure it's the same dog. I think it's just had a brush. But I was also a little bit like, especially when you did this. I was like, okay, I'm pretty sure it's the same dog. So you can see, definitely moving better. This one's definitely the same dog. But you can see she's limping and she's sore. And then she's like, yeah, I can move more freely. So you can see, I like doing the side-by-side videos. So it really helps you to sort of see how the pain changes. So again, you've got checklists in your bag that goes through the common signs of pain in pets. And so it's a good thing to do that checklist every now and then, just to be like, hey, where are we rating on this? And sometimes when we're managing arthritis pain, we will actually use pain scores to see that the treatment's improving as well. Any questions about signs of pain in dogs and cats?
Is the osteoarthritis worse in the colder weather?
It can be, yeah, and it does. It's a little dependent on the pet, but I find that we see more symptoms of arthritis in the cooler weather. And I know myself, I broke my foot skateboarding out here when I first opened the vet clinic, and for a couple of years, whenever it was really cold, winter, my foot was really sore from that, and it was just the arthritis associated with the little break in my foot. No, I haven't skateboarded again since then.
You've grown up.
Exactly. I was like, I don't know why I did in the first place. I never could skateboard, why I chose to then. Anyway.
Hello, I'm Nicole. I see a lot of familiar faces. I think I've met a lot of you before, but if not, I'm Nicole. I'm one of the vets here, and dental stuff is a particular interest of mine. I don't have any fun pictures of my pets, but I was reminded as I was preparing for this that I am a senior pet owner as well. My girl is 7 this year, so she's starting to get older. And she's a Labrador. My Labrador before that was almost 16 when he passed. He's how I met Belinda. So he had really advanced arthritis. I'd done everything that I could to manage it, and his legs were still basically falling off. So I went to Belinda to have him treated with acupuncture, and it was amazing. But anyway, back to dental disease. Like I said, it's a particular interest of mine. So why do we even care about dental disease? There's a lot of reasons why. Teeth are really important. There have been a lot of meta studies, especially coming out of Japan in the past few years, that are linking missing teeth, so basically dental disease, with a number of health conditions in humans, overall increase all-cause mortality, dementia, certain types of cancers. One in particular that I found quite interesting was, again, for humans, one of these meta-studies out of Japan. So the study found that for humans up to 70 years old, you could lose a maximum of 17 teeth. And then for every year old you became after that, or for every tooth you lost after that point, there was actually an association with a number of, again, health conditions and all-cause mortality, showing for every single tooth you lost beyond 17 over 70 years of age, there was a 4% increase in mortality. So you add, how many teeth we have. Dogs have 42 teeth, so if you kind of extrapolate that data, that really adds up. There are some really good studies in Marion Island, so it's an island off the coast of Africa, in a wild cat population there, where they found most of those cats had a lot of broken teeth, and the cats that did have broken teeth did have decreased lifespans and a lot of health conditions associated with those tooth fractures. And we can really assume that that extends to domestic cats as well, and dogs. And anecdotally, I do see that a lot in our patients as well. We'll do the next one. So Belinda kind of touched on a bit of this, but again, why do we care about teeth? So periodontal disease, and we'll kind of get into a bit later what that is. But it contributes to chronic inflammation, okay? It can lead to a long-term kind of chronic low-grade bacteria floating through the bloodstream that are coming from your mouth, or even larger pulses of bacteria that your body has to really deal with. And when those bacteria are floating around, especially in older individuals who may not have a perfect immune system anymore, who might have also other underlying health conditions that maybe we actually haven't recognized yet or haven't made themselves that apparent yet, can really kind of tip the balance with those conditions. And so you can get heart problems where the bacteria can get kind of seeded onto the valves of the heart or cause inflammation on the inside lining of the heart. You can get urinary tract problems, kidney problems, like Belinda was saying, she was trying to make sure that she was managing with her dog. Pneumonia, so those bacteria they travel through the lungs. For diabetics, we find dental disease really impacts their diabetic control. Diabetics with bad periodontal disease or dental problems end up needing a lot more insulin to stay stable. A lot of pets with dental disease do just end up with generalized poor health. And especially in cats, there are actually links between dental disease and certain types of dental disease, in particular to IBD or inflammatory bowel conditions. So overall, in summary, focusing on pets' dental health actually does provide them with a better quality of life. It gives us more happy years with them. It can impact their overall lifespan. And as Belinda kind of mentioned, a lot of pets really instinctively hide pain, or it can be really difficult to detect. And I find a lot of pets really instinctively hide pain, especially around their face and their head. You wouldn't believe some of the dogs, cats that I see come in with terrible eye problems, ear problems, terrible mouths. People with those same conditions would be really, really complaining, really miserable with. And these pets just walk in like, hey, what's going on? I'm here. You don't really see any signs of it. And you don't really know how much it impacts them until you actually go and address that problem.
Sorry.
So kind of getting back to periodontal disease, a bit of a buzzword, and what is that even? So periodontal disease is basically when you get plaque and the bacteria from plaque plus inflammation, okay? The bacteria in the plaque end up building a bridge for other more opportunistic bad bacteria to come and establish in the mouth. And then what you end up having happening is the gums and the underlying bone, even the ligaments that hold the teeth in, try to recede away from that threat of those bacteria that are just constantly sitting there. So that's what we call attachment loss, when we get the gum line and the underlying bone and even the ligaments that hold the teeth in place starting to walk away from that, and that's what also leads to tooth loss. So we know that 85% of dogs between 2 and 3 years old have periodontal disease. Okay, so in our senior pets, you know, those numbers and the severity of periodontal disease become a lot more apparent. And in cats, 75% of cats over 3 years old have periodontal disease. And then another interesting thing that cats get are resorptive lesions. And so older cats, more prone to getting resorptive lesions, and especially the Asian breeds, so you know, your Siamese, Burmese, there's a long list of other kind of Asian breeds as well that are more prone to getting these types of periodontal, these types of resorptive lesions. But you can see up to 75% of older cats, senior cats, can have these resorptive lesions, and a lot of times we don't find them unless we are specifically looking for them and specifically assessing their oral health. So how do we know if our pets have dental problems? How do we know if they have periodontal disease? So bad breath is the #1 sign. Bad breath is not a normal thing. So that's the biggest thing to look out for. If your pet has persistent bad breath, that's a sign that we need to be looking into what's going on there. If you're doing home care and you're brushing, or if you're doing other things in the mouth, but sometimes if dogs are just chewing even on soft toys and you're persistently seeing blood on the soft toy or on the toothbrush or whatever you're kind of doing in their mouth, that's a sign that there's something going on with those gums. You have to say, why are they bleeding? And of course, doing a proper oral exam is really the kind of quickest, easiest way to detect if a pet has signs of periodontal disease or dental problems. So what do we do about dental problems? So typically what we need to do, again, we get our initial oral examination. A lot of times what we'll see is there might be a lot of tartar or calculus, there might be gingivitis. A lot of times we can identify if there is gum line recession or attachment loss or other types of things. A lot of times we can see, you know, broken teeth if those are a problem. Sometimes, especially if we're just seeing some gingivitis, or if we're just seeing big bits of tartar stuck to the teeth, is when we might say, hey, look, it's really time to get a more comprehensive oral health assessment, or what we call a COHA, or what a lot of people just refer to as generally a dental, okay? That does involve an anesthetic. It can't be done properly without an anesthetic. And I think hopefully I'm not giving anything away with the quiz, but you know, especially in older pets, right? Age is just a number. Age is not a disease. There are a lot of things that we worry about in older pets that could be diseases, but with a good physical examination and a blood, you know, some blood tests beforehand, we can really mitigate a lot of those risks and assess for a lot of those problems and make sure that we're not, you know, tipping the scales out of our favor. But when we're doing that more comprehensive exam under a general anesthetic, what we're doing is we're looking to assess the extent of the actual problem. Again, is this just a bunch of tartar on the teeth? Is this just a little bit of gingivitis? Or is there signs of attachment loss, gum line recession, those types of things?
Question, does this stuff come from a mix of things, or is it food based, or
That's a really good
age,
question.
or like for example, I know a client of mine, their dog was eating like a mix of kibble but also human based, say, foods.
Yeah.
And the teeth became really bad, but she was a younger dog.
Yeah.
And then the vet had said, stop feeding human food, just feed normal food.
Mhm.
But does that cause like the tartar and the
No.
holes and things like that?
No,
The
so
food?
your risk for developing periodontal disease it comes from your individual anatomy.
Mhm.
It comes from your genetics. So there are some breeds, so in dogs, breeds that are always going to be a big red flag for, hey, we need to keep on top of their oral health. So Cavaliers, Schnauzers, and Greyhounds are kind of the poster children for bad teeth. And that extends a lot to the mixes as well. We're seeing a lot of Cavalier mixes now, you know, and a lot of those pets inherit those bad Cavalier, you know, periodontal problems. Food is actually not a factor. Food doesn't really play a role in whether or not you're going to be developing periodontal disease, unless you're on a diet that's specifically made to help manage dental problems. So, you know, like an oral care or a TD or something like that. There are also, so those Marion Island cat studies I mentioned, actually there was a lot of valuable information from those. And another guy studying the African wild dogs as well, kind of similar things in dog species, have found that those animals, those wild animals who eat nothing but raw meat and bones, have the exact same incidence of periodontal disease as pets. So we know that what they're eating is not contributing, and likewise we know that eating bones, chewing on bones and things like that, isn't actually helping their teeth. And I see a lot of the pets that actually come in who are being fed raw bones. A lot of them have broken teeth. A lot of the pets, I will say, who are fed chicken necks and chicken wings and things like that, I see a lot of them tend to be a bit overweight as well. So I think we're packing in a lot of extra calories and not actually getting a lot back from that. Did that answer your question?
Yeah, no, that's good, thank you.
So yeah, so when we get in there and we're assessing the extent of the problem, we're probing around every single surface of every single tooth. We're getting a full mouth exam, we're charting those teeth, what's happening with them at this point in time, or getting x-rays. X-rays are really important. Again, for cats, we're not usually finding those resorptive lesions unless we're taking x-rays. For both cats and dogs, about 60% of the tooth on average actually lies below the gum line. So if we're not taking x-rays, we're missing a lot. And that is one of those things, again, I'm a little bit passionate about. I think if you've got friends and family with senior pets or any pets that are going for dental procedures, you know, it's not all about a cleaning. The cleaning isn't the point. The point is we're obtaining a diagnosis and we're formulating a treatment plan for what's going on. And I'll get to that in just a minute, but you know, the treatment plan might be as simple as some home care, or it might be a little bit more advanced. But if someone's going in for dental and just comes out with a clean mouth and no report of these are areas that we maybe need to watch, this is some stuff that might come up in the future, no x-rays or anything like that. You know, we're providing some benefit to those pets, but we could be doing better. And again, it's more than just a cleaning. We're not recommending it just to go and clean up the mouth, right? We need to assess what the problem is. We need to figure out what's going on. We need to make sure that we can save the teeth and keep the mouth as healthy as possible. And I always kind of make a joke, like the cleaning definitely, again, is a part of it, but I'm not here to be a mouth janitor. I'm doing it for more than just making it look pretty. Again, as far as possible treatments and preventing dental problems and periodontal disease, that's where home care comes in. Now, home care, especially daily brushing, can prevent up to 85% of periodontal disease, okay? It goes a long way. Bear in mind though, that 85% is a big number. We're preventing a lot of that, but you're still gonna get that kind of 15% slipping through the cracks. It's not gonna prevent every pet from ever having to come in and have professional intervention, but it can really extend the amount of time between when we need to get in there and do those anesthetics and do the bigger things, okay? Likewise, we want to bear in mind that if we are doing home care after a dental cleaning, or if we're recommending to be doing home care after a dental cleaning, If we're not on top of that as we could be, or if we skip that step, there are a lot of pets who will come back in as little as 3 to 4 months and their mouth looks really similar to the way it did before we came in for a clean. So kind of following up and doing some maintenance goes a long way. With home dental care, we need to be disrupting that plaque formation. So the plaque are carrying that bacteria. We need to be disrupting that from the teeth at least once every 24 hours, okay? Again, nothing is as good as daily brushing, just like with us, okay? But there are a lot of additional options available for pets where brushing is just not gonna happen, for people where your schedule might not support that daily kind of more in-depth contact, or where, you know, we just kind of want some added layers of help on there.
So what's better, physically brushing or a dental stick or both, or what's the better one?
Yeah, so physically brushing with a bristled toothbrush is going to get you the farthest. There are some, I didn't actually bring any of my dental stuff up. We've got now some little microfiber cloths that fit over your finger. So as you're learning to brush, or for pets who might not quite accept a bristled brush, at least not yet, that can be a really good stepping stone. I see a lot of people using the little rubber finger brushes with the little bristles. I hate those. Just take it and throw it in the bin. They're big, they're not that pliable, they're cumbersome, and especially for little dogs, you know, like your little girl, for Roxy over here, like there's no way that brush is fitting all the way to the back teeth where it needs to be. It causes a lot of frustration on people. Say, I've tried brushing, it didn't work, it was too hard, my dog hated it. You know, you give up pretty quickly, and when you kind of get into the nitty gritty of, okay, well, what were you doing, how were you approaching it? They were using the rubber finger brush, and that was 50% of the problem there. So yeah, bristled toothbrush, you can use toothpaste, pet toothpaste, not human toothpaste. But to be honest, I mean, there really isn't anything proven in the toothpaste that do much. It's more just kind of flavoring to make it more acceptable for a lot of pets. Okay, so just warm water on the bristles works just as well.
But a dental, like if someone gave their dog a dental stick or their cat a dental biscuit or whatever, it would be
It can help a lot. Yep. A lot of the dental chews and the dental diets work predominantly for the back teeth, and so some of the canines in the front teeth might be a little bit left behind, because a lot of those really depend on the mechanical action of chewing to help disrupt that plaque. Especially with your dental chews, looking for this guy here becomes really important. If you're going to be putting forth the money for those dental chews, getting something that's got data behind it showing that it's efficacious at doing what you're putting your money for can really, really help. The options here in Australia are not as amazing as they are some places like over in the States, but the best dental chews that we've got here now are Greenies, Whimsies. Virbac has a new one out this year called CET VeggieDent, and Oravet. Oravet actually treat the whole mouth. They're embedded with a thing that kind of, as they chew it, gets released and moves around with the saliva. The other ones all just do great for the back teeth, and that's the same with the dental diets, okay? Hill's Oral Care has this VOHC seal of acceptance, and that's a great one that you can just get at any of the pet stores, okay? If you've got a big dog, or a dog that isn't as good at chewing, gobbles their food, so like my Labrador will try and swallow these big dental biscuits whole. So going more to the prescription range and getting like the Hill's TD, that's a big, it looks like a chicken nugget. For bigger dogs, the Hill's TD can be a little bit better if you're going to the dental diet. But you don't have to go into the prescription ranges anymore to get something good and worthwhile. Yeah, so come and see us if you have any suspicions about what might be going on, if you know that your dog or your cat has bad breath. come and see us for a dental exam. Any of the vets, even the nurses, are really skilled at identifying dental problems, and we can get you a much more individualized plan. So do you need to come in maybe for a more comprehensive oral health assessment? Should we get those x-rays? Should we kind of get it clean and back to baseline, ready for home care? Is home care going to be enough at this point in time? You know, for a lot of pets that can be the case. And we can help you come up with an individualized plan for what's going to work best for you and for your pet, because there are some more options as well. I think there's some here as well. There's some water additives, some gels, and wipes and other things that we've got as well that we can help kind of guide you through what might be best for your particular situation. And that was it. Any other questions? Excellent.
Right, so I'm going to talk a bit about the importance of annual blood and urine screening in pets. So we've talked a little bit about all the different diseases that we get worried about as our pets age. And by doing regular blood and urine testing, we can actually help to try to pick those things up a little bit earlier as well. So we recommend that once a year they come in and they have an annual blood and urine test. A lot of the time that does happen to coincide with them having a dental procedure, that they're having an anaesthetic. We're just going to do the blood test at the same time. What we want to do with that is we want to establish a baseline, what's normal for your pet, and then we track that over time. And when we track that over time, we're able to catch issues or disease processes earlier in the disease, in the process of the disease. So it can help to guide us or catch things before it becomes a big issue. And then that's obviously going to improve their long-term outcome, that's going to improve their quality of life and make them feel better as well. Go to the next slide, because on this next slide, IDEXX did this so IDEXX is a blood lab over in Australia and over in the States. They did this really long study and they tested about 140,000 pets. They did a blood test on them when they were well, of all different ages. And what they found is that in senior pets, so in senior cats over the age of 9, 3 out of 5 of those senior wellness blood tests found something that was clinically significant and needed something done. And the same study also found 2 in 5 dogs. They found something that was clinically significant, which meant it either needed following up or a diet change, or they were actually able to find something there. And Charlotte kind of touched on that too with her dog Summer, that she was just having a urine test and picked up that she had a urinary tract infection. Wouldn't have known that was there. I found with Jack, so Jack ended up having early renal disease, so stage 2, kidney disease in pets. We grade it from 1 to 4, with 4 being the worst. I caught Jack in stage 2 renal disease because he had a blood test before a dental. And so I was able to manage his kidney disease for a long time just with diet. All it meant was that I had to change his diet. So it wasn't a big change in our life, but it made a big positive impact on his kidneys. It reduced the pressure that was getting put on his kidneys every day. So that's sort of why we look at doing annual blood and urine tests. We're also, the computer program we use, it allows us to actually chart them as well over time. So any of our patients were able to just pull up the chart and say, hey, what was the kidney function last time? Let's compare it to last year. So, you know, as we're getting more years worth of data, we're able to say, okay, kidney function's normally here, and then all of a sudden it steps up. It might still be in the normal range, but that might be abnormal for our individual, because for our individual, normal is actually down here, and now we're suddenly up here. So that's where that's really beneficial. Go to the next one, and it'll be a surprise for me too. Okay. So what are we testing for? I guess that's important to know. What are we testing for on the blood test? So we're looking for signs of infection. That's important for our lungs and our heart. We want to make sure that there's no major inflammation in our blood. We're testing their liver function. So their liver helps to process medications. It helps to deal with toxins that come into our system. So we want to make sure the liver's functioning okay. I have another example of a dog who, Ali, I saw her maybe 10, 12 years ago, but she sticks in my mind because she came in for a dental and we did a blood test and she had high liver enzymes. And I was like, whoo, okay, we're not doing your teeth today. We're going to find out why these liver enzymes are so high. And we did an ultrasound and we found that she had a liver tumour. And I was like, oh no, this is not good. The great news was the liver tumour was operable. So I was able to remove that mass from her liver and she lived 4 more years. Normal quality of life. It was a benign tumour, but it was one that was getting so big it would have got to the point it was going to cause a problem. So the fact we were able to remove that and caught that on a pre-anesthetic blood test, I just was like, I'm sold on these. These are great. Like, this is, if it only saves, you know, one alley every year or whatever for me, then that's more than worth it. The other things we're testing for, we're looking for signs of disease in the pancreas and in the intestines. We're checking the kidneys. Like I said with Jack, that's how I found out he had early kidney disease. We're looking at their thyroid. 10% of cats over 10 will have thyroid issues, so we want to check their thyroid. We're looking at the red and white blood cells. We're looking at their platelet count to make sure they're not bleeding issues either. And the urine test tells us a bunch of information as well. So the urine is checking, yes, it's checking for infection. It's telling us more information about how well those kidneys are working. Is there any protein being lost? And that's what happened in Cassie. She had lots of protein in her urine because her kidneys weren't working properly. It also checks for diabetes as well. So that's why we do the combination of the blood and the urine tests, just to sort of see what's going on in that whole, give us that whole picture of everything that's happening. And yeah, I think that is very, very valuable information that we get, that we track over time. The aim is for them always to be normal, right? Like, I know it's like one of those things like, oh, what value are we getting if the blood test is normal? That's great news. That tells me that everything's working well, and then if there is an issue, we're hopefully catching it before it becomes a big issue. Okay.
Can I ask a question?
Yeah, absolutely.
So, blood and urine tests, I know you take blood
Yes.
to do
Yeah.
testing.
Yeah.
What about urine?
Yeah, so there's different ways to catch urine from an animal.
I don't want to have to follow my cat around.
Exactly.
She will be
In fact,
really.
she will not be. Princess will not be happy with that.
No, she will be a princess. I can tell you that.
So there's different ways to get urine. So one way, yes, trying to catch it. A bit easier with a dog, but I would still not use a little urine container. I would use like a kidney dish or like an empty food, like Chinese food container or something like that to just tuck under and catch it. A clean one, yes, definitely clean and dry. If that doesn't work, sometimes we need to do, sometimes what we need to do is called a cystocentesis. So we use the ultrasound to see the bladder, and we stick a needle directly into the bladder and get urine out that way.
Under anesthetic.
Sometimes it's under anesthetic. It depends on the pet. Some of them, if they're super food motivated and they're pretty relaxed in the clinic, we'll be feeding, like cats in particular, we'll be feeding them a squeezy cat treat. They'll be just like, oh, someone's giving me pats and I'm getting this yummy, delicious treat, and I'm just like, whoop, got the urine sample and they haven't even really noticed. Others are a bit more like, you're touching my belly, I am not okay with this, as probably most cats are actually. It's a trap. If they lay over and they say, pat my belly, it's a trap. I'll press the button one more time. So this, I didn't realise, I forgot I put this slide in here. So this is my little boy Jack. My kids were a lot smaller then, they're a lot bigger now. Yeah, they're 12 and 15 now, so they're much bigger than they were in that picture. Okay, so yeah, so I was able to manage his kidney disease for 3 years from his diagnosis. And it was really important for me to have that information that he had stage 2 renal failure, because he also had arthritis, and I wanted to manage his pain, but I didn't want to mess with his kidneys. So for me, that was super important that I had that information. Pain management! Excellent. I'm really passionate about pain management and making sure that we keep our pets as comfortable as possible. So we use a lot of things when we're looking at pain management. It's a multimodal approach, okay? So many different ways to make them feel as comfortable as possible. I think that our senior pets give us so much throughout their lives. The least we can do is make sure they are as comfortable as possible and happy as possible as they get old. So the first topic's a little bit, it's not fun. Who wants to talk about weight management? We'll go to that next slide. So whilst it's like, I find it a bit like, I know they have to go on a diet. It actually is one of the most important things we can do for them, is keeping their weight under control. So they did a lifetime study in dogs that they split dogs into 2 groups. One group of dogs, they were fed freely and allowed to eat as much as they liked. The second group of dogs were kept at a really lean body condition. By the age of 5, the dogs that were fed as much as they wanted developed arthritis. It took until the age they turned 10 for the dogs that were kept lean to develop signs of arthritis. So we are able to push back the time the time before they develop arthritis by keeping their weight under control. So that's why I say it's a little bit depressing that we can't give them as many snacks as we want, and they often will give us those puppy dog eyes. So we need to make good food choices for them with their vegetables. But the best way to alleviate pain in our pets is to keep them at their appropriate weight. Because the more weight they're carrying, the extra pressure it's putting on the joints, the extra damage that's going to the joints, the more pain they are in, and the shorter their lifespan is. So it is so very important. And if you are struggling with trying to get your pet's weight under control, you are not alone. Our nurses are incredible. Charlotte is so passionate about nutrition. She would love to help you to get their diet under control and help to make it as pain-free as possible for both of you. Because, you know, it's hard on the pet when they're like, but you used to feed me everything. And it's also hard on you because they're giving you puppy dog eyes or kitty cat eyes and you're like, I'm sorry. But it really is, I can't emphasize it enough how important it is to their longevity that we keep their weight under control. Okay, next slide. Supplements and medications. So we obviously prescribe a lot of these. We do a lot in this area. So supplements can work to reduce inflammation. They can help with anxiety associated with pain. And there's even diets that have got those things built into the diet. So you're not even necessarily having to give extra supplements and things. Now, when it comes to supplementation, there are so many on the market. It is like mind-blowingly confusing how many different products are available as a supplement for pets. Unfortunately, the pet supplement market isn't well regulated. So I can go to my kitchen and say, hey, this is a great combination that may help with joints, and I can sell that to you. I won't have to necessarily do any testing to prove that it works because it may help. And so there is a lot of that kind of stuff that is out there. We recommend Antinol Rapid as our primary supplement for joints, for dogs and for cats. It's a natural anti-inflammatory. I like it for two reasons. They've done efficacy studies that show it works. So they've compared it to a non-steroidal anti-inflammatory and found that when they did that, they got 80% of the improvement that they got compared to the 100% on, say, the anti-inflammatory. So that's a pretty good, that's like, 4/5 of the improvement they got from the Antinol Rapid. Okay, so I like that. They did safety studies to show it doesn't affect the liver over time. Things like glucosamine and chondroitin. In the past, yes, I did recommend those, but we now know that there is no improvement on glucosamine and chondroitin compared to placebo. So it doesn't necessarily actually help them a huge amount. There are other things, and there might be more studies that come out. It's just that companies aren't doing the studies on them yet, but things like turmeric can be helpful. I know I get anecdotal evidence that cats do, certain animals will do really well on rose hip fight or glide, or there's honestly so many different ones. But that's why we tend to recommend the Antinol Rapid, because we know they've got the studies and the backing behind it, and also we get really good feedback from our clients about it as well. That it's quite palatable, and we see the improvement with our patients on it.
Sorry,
Yeah.
with that, is that something that given till they have arthritis? I know a lot of people, the dogs don't have arthritis and they're already giving it to them. Is it like a pretty...
Yeah, so I guess, if we know that they're they're at increased risk of developing arthritis, so they may be like, I'm a large breed dog and I'm at risk of hip dysplasia, then yes, there's no harm in starting them on it sooner. And I guess the idea with that is minimizing the amount of inflammation that's happening in the joints. Because as the more inflammation that happens in the joints, the more irritation that happens, the more chronic changes you get with arthritis, right? So you've got inflammation, and then you start getting bony spurs forming, then you get scar tissue and all the capsule and the ligaments around the joints as well, and then that's what's making it painful, is that combination of inflammation and bone spurs and thickened tissue around the joints. It's restricting the joints and stopping them moving as well. So yeah, you can't start them on it too early, because it just affects your bank balance a little, is the main thing. And I guess the great thing with supplements is they're over the counter. Yeah.
I have a question. She's got a very sensitive stomach, so she's not allowed to eat anything, but I would love to give her supplements.
Yes.
She's 13.
Yeah.
So how do you manage that to be able to give her something that would not upset the rest?
Yeah, and it becomes a little bit of a balancing act, and it's sort of, I guess, do you know if there's things that it's like, she tends to be worse with fish, or if she's generally okay with fish, or like...
We've eliminated any protein. She's on the Royal Canine gastrointestinal diet, and that's all she's having. Yeah.
And so then I guess it becomes like that little bit of a risk of like, do we try it? Do we not try it? And then just sort of, it is like, oh, is this going to work or is this not? And sometimes we go, you know what? It's not when her tummy flares up, it is too bad. It's just too much, and we don't want to even go down risking that. Then we might look at other ways of getting medication, or like rather than looking at the supplements, you might go, well, let's look at some of these more milder medications that aren't going to necessarily upset a tummy. So one of the medications I'll talk about, which might be appropriate for her, it's called Cinevan. So what Cinevan does is it increases the amount of joint fluid in every joint in her body, or in their body, helps them all to run a bit more smoothly, acts as a local anti-inflammatory in the joints. It's an injection under the skin once a week for 4 weeks, and the effects last for 6 months. It can be used in dogs and cats. It tends to be really well tolerated, so very rarely do you get any side effects with that one. It is very safe. So it might be worth like that you go, okay, we can't do the daily supplement, but maybe we can start her on the Cinevan injections. And I do really like the Cinevan injections for early stages of arthritis, because I find that it's often enough in those early stages to just give them a bit of a bounce back. It takes up to the 3rd injection before you see the improvement with the Cinevan injections, but then generally that improvement hangs around for 6 months. As arthritis progresses, sometimes then the Cinevan's not strong enough and we need to add in other things. And when we're looking at medications, again, we do this like multimodal approach to medication. The reason we're doing lots of different things to make their mobility better and make them feel more comfortable is that we can get away with lower doses of doing some of each of these different things, and you get a better outcome with less side effects. So if we're targeting the pain pathways at different points along the pathway, if I was to just rely on one medication and go, oh, it stopped working, I'm going to put the dose up, we're going to get to a point where there's a ceiling effect, where the benefit is not going to get any bigger, but the side effects are going to get bigger, right? So instead of doing that, we'll go, okay, we might start with an anti-inflammatory, which might be our Antinol, and then we might add in the Cinevan, and then we'll be good for a bit, because arthritis is progressive and degenerative, so it gets worse over time. And then we might go, okay, now we need to add in, getting a bit of a sore back, we've got a bit of a pinched nerve, we might need to add in a bit of nerve pain treatment as well, so we might add in something for that. So yes, they feel like they're rattling because they're having lots of different things, but the side effects are minimal because it's lots of little things at low doses rather than any one thing at a really high dose. And then we'll talk about physical therapies and exercise in a minute as well, because that's also a really important part of it. The videos that we watched with the dogs and cats being stiff and then being like amazing, that they're getting, the dog version is called Baranza and the cat version is called Silencia, and those are monoclonal antibodies, and what they do is it's like an immune modulator. It attacks the the signals for the pain that the body sends out that says, hey, this is painful, this arthritis is painful, it attacks that. So it's very targeted therapy, minimal side effects with that. It lasts for a month, so it requires re-injection every month, okay? So that's why sometimes I'll often start with the Cinevan injections, because when that works, that lasts for 6 months, and that's you know, twice a year coming in for 2 little short visits, you know, a few short visits for the injections. But certainly the Baranza we do see, and the Silencia, we do see some of our senior patients with that working really well for those later stages of arthritis. CBD oil, that's something that I will prescribe for arthritis as well, so cannabis. The biggest downside with CBD oil is the cost. So CBD can be great for dogs with pain, and it can also help with their anxiety as well. Sometimes it'll help with their appetite too. But the downside in Australia is it's really expensive. Any other questions around medications? Cool, flip to the next one. Exercise. So it's really important that even as our pets age, we do some gentle, regular exercise with them. If they're staying still and they're not doing anything, their muscles are wasting. If their muscles are wasting, they can't support their joints, and then their arthritis is going to feel worse as well. So it's really important though that when we do exercise them, we don't go from 0 to 100. You know how if we haven't gone to the gym and then we go to the gym and we do a really hard workout and then for days afterwards we're really sore? I'm doing a rehab course for animals as well, so that's called DOMS, or delayed onset muscle soreness. Animals can get that too if you go too hard with the exercise. They will be like, oh man, what have you done to me? But on top of that, if they're old and they get that, then they've also probably got arthritis pain that you've flared up too. So I think going on sniff adventures for old dogs is really good. If they like going out, just so like literally sniff the flowers, you know, go around, check the P-mail, do all those little fun things. It doesn't have to be a long walk, it just has to be you know, something that's enjoyable for their brain, and also just keeping them moving a little bit. Again, if they're not moving at all, those capsules around their joints are going to seize up too, so then they're going to have reduced mobility. And I didn't really know where to put it, but I thought this will be a good spot, is that it's a really good idea to elevate your food and water bowls for senior pets. Jack in particular, as he got older, really struggled with his food and water bowls being down on the floor. So if you've got arthritis in your elbows or in your shoulders and you're having to bend down like this and put lots of pressure to get all the way down to the floor, that's going to be hard. If you've got sore hips and you're like trying to not extend them too much and you're having to bend down, that's causing you to extend your hips out a bit. If your back's sore, that's stretching your back when you're bending down like that. So just having the food and water bowls elevated just to head height, so you can just walk up and eat like that, really can make a difference, and making sure there's a non-slip mat underneath them as well, just so that they don't then start doing these ones, splaying their legs out when they're trying to stand still. Because some of them you'll see struggle to stand in one spot for too long because of the weakness of their muscles. And that, this is my laser over here. So we've got a class 4 therapeutic laser, and it is really good for pain management. It helps with inflammation and pain and swelling. And so we use it post-operatively, but we also use it for arthritis and managing pain in pets as well. The benefit with the laser is that it's non-invasive, so it basically just feels like a warm light going across them, so they just feel a little bit of heat. So it heats up the area, which often with arthritis, they don't mind that because it kind of feels nice. They do get to wear really cool goggles, just like Roxy did in this picture. But there is a plan if they don't like the goggles as well. But you also have to wear the goggles too, the other ones. Less cool goggles here because it's dangerous for your eyes. So I won't be doing a demonstration of this tonight. But it is really good at just helping to relax muscle knots, and it helps with that arthritis pain. Our nurses are all trained in using the laser, and yeah, we get good results with that as well. So this is an example of a physical therapy that is going to help with their mobility. Other great thing, no side effects from it. The only reason we can't use it would be if they had a tumour. We wouldn't want to, or a cancer, we wouldn't want to use it over that directly because it can promote blood flow to the area. We don't want to promote blood flow to a tumour and potentially make it grow faster. So that's the only reason we don't tend to use the laser. Next one. This is Moira. Moira is one of my patients who has acupuncture with me. So acupuncture has been used in animals for about 4,500 years, making it one of the oldest systems of medicine still used today. We use tiny little needles inserted into specific points in the body, and we try to tap into the body's innate ability to heal itself. I have been using acupuncture in animals since 2008, so I'm a certified veterinary acupuncturist, and I've treated many patients over many years. I'm on the board of directors of the Australian College of Veterinary Acupuncture, and I've been an examiner for the college as well, so I've really sort of lent into the acupuncture space. And certainly the most common reason I use acupuncture is for arthritis and pain management in pets. Particularly, I do a lot of pets that have got sore backs. I have, how many sausage dogs do I see? Oh my goodness, that have had like...
Friday, that's about 5.
Yeah. That have done a disc, sausage dogs are really prone to disc disease, so they'll get bulging discs or discs that completely protrude, and then that causes a lot of spinal pain, and in some dogs that'll cause paralysis as well. Quite a few of them might be post-operative. I think a couple of them have already had surgery, and we're just doing acupuncture to strengthen their back and make sure that they feel nice and comfortable as well.
I imagine you don't do that with cats. Do
I
cats?
do acupuncture on cats.
It's not like, oh,
You
surely
need
that's
super
just
up there.
Yeah.
Oh my gosh.
What criteria is there for the different pain management techniques that you have, acupuncture versus medication?
Yeah.
Is there like grades?
Yeah, so I guess it depends a little bit on, there will be, I guess, differences on like what the presenting issue is, what the potential side effects of medication might be versus like if we're concerned about certain medications upsetting tummies, or we've got other disease processes, then we might reach for acupuncture and laser first. If they're really needle phobic, we'll probably go for laser. Because there are some patients that I would love to do acupuncture on, but if they get too stressed with the needles or they just hate needles, then it's like, okay, I can't do that. And I'm very honest as well. I'll be like, look, this is not working, they're getting too stressed. We're not going to, anyone who's been in a consult with me knows I'm not going to pin them down and do I'm just getting it done. It's going to be really good. I had a human acupuncturist basically do that to me. She was like, I know this hurts, but it's a really good spot and I just want to do it. And I was like, I don't have a choice, do I? And so, she I was getting treated for sinusitis, so she's putting needles in right next to my nose, and I'm like, oh no. So I'm not going to do that with animals because I want them to come back for another treatment. And if I make them like really sore or scared, it's not going, any benefit is going to be outweighed by how stressed they were with the treatment as well. So yeah, it's a little bit of individual, like that's why it's not sort of clear cut, but we can do a combination of everything all together. We can start with just one, or we can, it'll depend as well what I find on physical exam. So if I'm finding some really tight muscles, then I might be like, I know that really tight knotted muscles aren't going to respond as well to anti-inflammatories. They need a physical therapy to help release those muscles. So we're going to reach for laser, we're going to reach for acupuncture. We might do the laser, then follow it straight with the acupuncture, because the laser will relax those muscles a bit, and the needles will go in a bit more comfortably and help to keep that muscle not relaxed as well. Can't remember, let's go to the next one. Let's see. Oh, conclusions. Oh, well, you've all done really well. Because I think it's gone a little longer than anticipated. So basically the conclusions are that we want to schedule regular veterinary checkups, at least every 6 months for our senior pets. Things change really quickly in them as they age, so generally it's kind of nice to look at doing, it's like you might do your vaccine and check up in one, and then 6 months later you might do your senior wellness check, and that might be your dental check, and at that point we're like, okay, now we need to do teeth, so we're doing blood and urine at that point, and then again 6 months time it'll be the next vaccine and check over and stuff like that. So we try to line it up that way as well. Remember to look out for warning signs, and that early intervention is key. And don't forget that we're here to help you as well. So if you're not sure, or if you've got questions, just give us a call. All our nurses and receptionists are amazing at giving advice as to whether or not they think you need to come in, or flicking us an email. We get back to you as soon as we can with email. Sometimes it takes a little bit longer if we're really flat out in the clinic. So anything urgent, always call. There's not a slide, isn't there? Questions? Any other questions?
Is swimming good?
Oh yeah, absolutely. So look, I've spent a lot of time doing this today, and I was like, I'm sure I'm going to figure out something. So yeah, like things like swimming is great because it's like swimming is low impact, so it's not going to hurt as much on the joints. So harder in cats to convince them to swim. I have seen the very rare picture of a cat in an underwater treadmill. For very rare.
Princess went in involuntarily one day, and after that I got hubby to put some covers over the water containers so it didn't happen again.
Yes, generally that's how they end up in water, is involuntarily. But yeah, and certainly like the hydro treadmills and things like that can be really beneficial for them as well. So yeah, there are a few places around here that will use hydro treadmills as well. We recommend Stash for that. They've got the full rehab team that are there as well. So not all of the underwater treadmills will have fully qualified staff manning them as well. So again, no regulation. Like there's no regulation for veterinary acupuncture either. So whilst I am a certified veterinary acupuncturist, anybody can do animal acupuncture, which is somewhat terrifying. Especially like human acupuncturists, they can do animal acupuncture, but they don't know how to handle animals, and acupuncture is a powerful tool and it can mask things. So you want to know what the diagnosis is before you treat with acupuncture, because if there was, say, an underlying like spinal tumour or something like that, and we just went, hey, we're just going to treat with acupuncture and ignore that, we'll make it better for a period of time, and then they will crash.
I did have a question. For cats, obviously, as you said a few times, they're really quite hard to diagnose, and sometimes bloods and urines. With them particular as well, like they'll come to the vet and they won't show any signs because they're terrified. Is there anything we can do at home for senior pets, like pre-consultation, like videos, or like what makes your job easier to get to the bottom of these?
Look, I think, videoing is really helpful. Even I would say for dogs as well, like going, even if it's like, all right, we try to organise a video of what they look like when they run up the stairs, or, what they look like when they're following you, and things like that. Or, what do they do? Are they hesitating before they jump? And that really helps. If you're like, there's this weird behaviour happening and I'm not sure what it is, trying to capture it on film is always really helpful. And I know, Sheree, you've definitely tried many a times. I think
well, I did try to reenact it, and that wasn't great. I tried to be a cat, and not only embarrassed my partner, but everyone else.
It was amazing.
Visually, like you need to see it visually to understand.
That's right.
that's why I say to clients,
Yeah.
video the behaviour so then I know what's going on.
Yeah, absolutely. And then even like lamenesses and stuff, the nurses don't know it yet, but I'm going to be getting them to, because of my course I'm doing, I'm going to be getting them to film dogs walking past and things, and then I can slow it down and watch it in slow motion and work out, oh, okay, looks like, you know, where is the issue? Because sometimes, especially little dogs with such little legs, they move them so fast. You're like, I can tell you're not moving quite right. We need to slow it down to be able to see what's going on, especially when they've got those little legs going so quickly as well.
My second question was, how do you force cats to exercise?
So hard.
Well, my boy Tom,
Yes.
loves his food and he hasn't lost weight. He's now, I think, quite good. So when I was giving him kibble, I'm not at the moment,
Yeah.
obviously, but when I was giving him kibble, I didn't just put it there and he just had it. I'd throw it underneath it.
Yeah.
So and it's hunting, it's a natural behaviour, so he had to go looking for it.
Yeah, which is so good, right? Like tapping into those like natural
Engages him
behaviours.
as well.
Yeah, it's brilliant. It's like, you know, as you get older, doing crossword puzzles and stuff like that, you're making him use his brain, so that really helps him with the dementia and stuff.
I'm always thinking about the dog.
I don't know whether I was doing it and then I read it somewhere and realised, oh, great behaviour, or whether I read it and then,
Yeah.
Cat's gonna be mad that I'm gonna start throwing it tonight.
As long as Murphy's not like, I'll just take
My
something
girl,
else.
my girl Princess, because they're both seniors, she likes to come and she brought a mouse home recently. So she likes to go and see if she can find another mouse. And I don't stop her, and we've got a little routine. She goes up the truck yard, and I know where she'll be, so I bring her back. But that's exercise for her every day as well.
Absolutely, it's that
Finding something to make it fit in.
That's it, it's that incidental exercise that often, you know, is really helpful as well. Like I said earlier, like if they follow the food bowl, we'll just do an extra lap in the kitchen. You know, like that'll get them moving a little bit more as well.
When
So
Princess was very young, she used to, on the weekend, I'd walk around the property looking at what had changed through the week, particularly through winter, because leave home in dark, get home in dark. And she was like a dog. She walked the entire round. She doesn't do it anymore because they're a bit older.
yeah. Yep.
More sensible these days. She'd go all over the place with me.
Yeah. And that's it.
Wonderful.
It's perfect, and it's those sorts of little things that you'll find you'll be able to get little bits of incidental exercise. But yeah, cats are probably
Hard
2 in the
work.
morning. That's when they want to run around up and down the hallway, like jump on your head.
Because if I try to start it, he'll abuse me.
And then he
They get out of bed when they want you to.
then he can just like follow you around the house, yelling at you, chasing you, and then eventually you feed him.
That's great.
That's the exercise for both of you.
Exactly.